Well, guys, it's November 1st, the first day of open enrollment for individual health care. This open enrollment is going to last until December 15th if you want a January 1st effective date, and it actually goes through January 15th. That would give you a February 1st effective date. If you already have coverage with us, we're trying to get all of the applications switched over to a program called Health Sherpa. So if you've done applications with us in the past, I'm sure you've gotten an email from Health Sherpa. But if by some chance we've done your applications directly through the health insurance marketplace, then you would have been getting emails from the healthcare.gov. And even though we do applications on Health Sherpa, you'll still get those emails from the healthcare.gov website. This year, there's a lot of changes taking place. There's several new insurance companies jumping back into the health insurance marketplace. Even though they're brand names, I'm not trusting their networks yet. I've taken a look at their plans. Their plans look pretty good, but it doesn't necessarily mean I'm going to trust them the first year out. Usually, if you're in the North Georgia area and you need Northeast Georgia Medical Center as your hospital availability, then there's only two companies, Alliant and CareSource. Those are your go-to companies. Blue Cross and Blue Shield has had some network issues. Northside Hospital is pulling out of there. Ambetter also is making some adjustments between, I think it's Piedmont and Wellstar. I think Piedmont and Wellstar may be together. But anyway, there's a lot of changes taking place. So first of all, if you have a plan for 2021 and you like that plan, and unless you've gotten some sort of memo of any major changes that are going on, or unless maybe you got unemployment. Did you get unemployment this last year? Sometimes that can greatly, and I say drastically, change your tax subsidies for this next year. So if in 2021 you got unemployment, we might need to update that application for 2022. But probably that's already been censored through the health insurance marketplace, and you may be losing a big chunk of a tax subsidy that you already had. So if you're seeing some drastic changes, so here's what we need to do. Look and see if you've gotten any renewals at all. Or if you don't even have health insurance yet, you can go to policyhunters.com, which is our website. We're not going to chase you down. We're not going to call you. It's a safe place. I'll put the link down below, but you will be able to shop for individual health insurance without anybody bugging you. So it's these are the Affordable Care Act plans. These cover pre-existing conditions. They cover all your wellness. This is real health insurance. It only happens once a year to be able to get it unless you lose group coverage or something like that. But right now, starting November 1st through January 15th is the time you need to apply. If you've already had one of those plans for this year, we want to remain your agent. It's important to us because you're important to us. So we've worked really, really hard for you guys over the last few years. We appreciate you very, very much. So all I'm asking is if by some chance you'd go directly to the healthcare.gov website to update your application, please make certain that our agent information remains on there. I'll load that below too, so you'll know what that information is. But if you're using our link through Health Sherpa, it secures you as our client. You can update your applications yourself, and if you're not comfortable with that, simply reply back to this email and let us know what day, probably middle to late November. I'm already booked up for the first 2.5 weeks with appointments. But if you want me to help you dig through this, we'll be happy to do so. A lot of folks were just digging through and finding the best plans, then they're updating the applications themselves. When you reply to this email, if you'll just update us with your income information and also let us know if you have access to group health insurance. Now, I'm not saying do you have it or is it affordable, but if you have access to an employer-based plan or anyone in your family does, that individual, even if it's like your husband works there and you have access to it as a spouse, but you're not going to take it because it's too expensive, and usually they are, but you're not eligible for a tax subsidy in those situations. So please let us know if there's been any employment changes, any income changes. Have you moved? Has your marital status changed? Have you popped out any new people? Anyway, we want to stay on top of all this. We appreciate you very much. I'm going to put our contact information below. And if you got questions, feel free to reach back out. You guys have a great November. Turkey Day is right around the corner. Thanks. Bye.